There is immense potential role from Ayurveda to contribute to the healthcare of the public in many ailments which are unsatisfactorily managed or unsatisfactorily dealt by other systems of medicines. It's also a fact that there is lack of awareness among the Ayurvedic doctors regarding the clinical efficiency and the shortcomings, which means the strength and weakness of Ayurveda. This, I strongly feel, is attributed to the improper or lack of efficient training facilities from the sources of learning. Some sort of lacunae is realized in the training methods that are present from the learning sources now for the students and doctors of Ayurveda. Unfortunately, the same lack of awareness prevails among the public about the same aspect of the possibilities and not the possibilities of Ayurveda cure. And it's also quite painful to realize there is a lack of value of the concept of the value of the time, the money and the faith invested by patients on Ayurveda. And this does prevail, if not in every segment of Ayurveda, but in many segments of Ayurvedic doctors in and outside of Kerala. Unfortunately enough, there is a lack of documentation of the treated cases in the segment of Ayurveda, even though the richness of clinical experience of the Ayurvedic doctors in and outside Kerala is quite immense. And this is precisely an effort by agnivesh.info to make the documentation more possible and more shared with other doctors. As a fresh internee somewhere in 2001, I realized that there's a lack of common platform of information database from where the doctors can tap in the wealth of clinical experience of all the doctors in Kerala and outside. Unfortunately, there is lack of propagation of the parasurgical therapies of Ayurveda. There is lack of propagation of the Varmam therapies from Tamil Nadu also among the practicing doctors in Kerala. And this is due to the lack of sufficient knowledge of these topics among these doctors. Few of us, we government doctors, at a very unofficial and on a very voluntary basis, have taken up the task of training as many doctors we can and spreading the message of the efficacy of these Anushastras and Varmam to other doctors in Kerala and outside Kerala. And it is totally unofficial and charity-based efforts. We must also confess that there is lack of propagation of Ayurveda with sufficient evidences of the clinical efficacies in the public domain. It's also a fact that there is increasing interest displayed by other systems of medicines practitioners regarding the clinical possibilities of Ayurveda. And that would be a very good point for us to form bridges among different systems of medicines which are being practiced in Kerala and of course outside Kerala now. And that would eventually lead to a situation of better management of ailments for the welfare of patients. If you look into our eyes or look into the mirror in front of us, we would admit that the so-called Parampara Vaidyas function both authentically, genuinely, as well as quacks. Sometimes their knowledge in certain segments are definitely superior to that of academically trained physicians. It's quite an alarming situation which many doctors are not fully aware of, that the medicine resources are shrinking, the herbal plants are decreasing, and they are becoming more expensive due to surplus demand and diminished cultivation. Also, the foreign exports also contribute to this scarcity, and this is a reality and this is really scary. Many doctors are not aware of the fact that Ayurveda is very well practiced. I would say in certain cases even better than Kerala style in certain pockets of Ayurveda in the states of Karnataka, Maharashtra, Gujarat. But these pockets are very small, of course. And I must confess that Kerala is not the only authentic cradle of Ayurveda. There are many who do it very well outside Kerala also. It's also a fact that Europe, USA, Australia and many other foreign countries, people have shown increasing interest to realize the clinical strength of Ayurveda. And thousands of foreigners are seeking Ayurvedic therapies for the issues of health which are not well addressed in their countries. At least 80 countries people have come to Kerala for this. On a note of optimism, I would conclude that it is possible to revive the system in the way that can happen with the welfare of the doctors who practice it, and also by the welfare of patients who seeks its help. In the long run, the citizens of this country can be immensely helped in eradicating their medical health sufferings.